Combating the opioid crisis with expanded medical marijuana use, what would that look like? And would it be effective here in Texas? That was the topic of a South by Southwest panel today. KXAN Capitol correspondent Jayla Washington has more.
Right now I'm in what's called a flower room in a dispensary just outside of Austin, one of the only of its kind in the entire state of Texas. These are the plants used to make medicine, helping thousands of patients. And this business is hoping the conversation generated during South by Southwest will only help bring awareness to what they believe will help combat the opioid crisis. There are rooms full of cannabis in the Texas Original Compassionate Cultivation Dispensary. The CEO of the company, Morris Denton, says in the past 6 months, they've seen about 10,000 people get approved for medical cannabis use.
We have patients as young as 2 months and as old as 98.
Last year, they even partnered with a third-party company to research how it's impacting communities.
One of the quickest ways to address the opioid crisis is to allow people that are suffering from pain to have an alternative, and that alternative should be medical cannabis.
According to data from Morris's company's study, 41% of opioid users across the country reported a decreased need to use when having cannabis as an alternative.
Explanatory journalism.
Former journalist Ricardo Baca says most research comes from anecdotal experiences.
Today, cannabis remains federally illegal Schedule I drug, a nonsensical classification that is making top-tier medical research nearly impossible.
Leading this panel at South by Southwest, he shed light on certain legislative changes that might be necessary to make more progress in helping reduce addiction.
The primary measure of a medical cannabis infrastructure is looking at the qualifying conditions. What does that state allow for the qualifying condition for you to get a cannabis card? And right now in Texas, it's immensely limited.
Texas Governor Greg Abbott just last year did expand the low THC program to include people with PTSD and also raise the THC cap on medical cannabis to 1%.
That was Jayla Washington reporting. Texas lawmakers are currently researching the impact of fentanyl-related overdoses and deaths in the state, looking into ways to best deal with opioid abuse. Opioid use is top of mind in Austin right now, as we have recently seen an uptick in overdoses and deaths.